Hello everyone, let's begin with the first chapter, metabolic response to injury. So this chapter basically deals with all sorts of changes that happen in during the state of injury. Injury could be anything, be it trauma, or it could be surgery, be it emergency surgery or elective surgery, anything. So whenever there is trauma, or if the patient is in post-op critical care, there are so many changes happening in the metabolisms in the body. Carbohydrate metabolism changes, the protein metabolism changes, the fat metabolism changes. All these things is what we are going to study in this chapter. Okay, before we begin, there are four names of the scientists that we need to remember, just because it has been given in Bailey and Love. Not that not necessarily that it will be asked in the exam, but then it's better. Okay, so the first is the homeostasis. Remember, this is not hemostasis. Hemostasis is achieving control of bleeding, right? This is homeostasis, which basically means that to achieve a balance between synthesis and breakdown, right? That is what this first statement also means, that homeostasis is the foundation of normal physiology. Basically, there is always a balance in the body between synthesis and breakdown, and this balance or this equilibrium is called homeostasis, which is necessary for normal physiology of the body, right? This entire concept of homeostasis was given by Walter Cannon. The second name is milieu interior, which was given by Claude Bernard. The third name that we need to remember is this entire concept of metabolic response to injury. Metabolic response to injury was given by John Hunter. And the ebb and flow model. These are the four names that we need to remember. The ebb and flow model was given by David Cuthbertson. Okay, I haven't seen many questions being asked from these three, but this was one constant question that was getting asked in at least the mock exams that I gave. Okay, now we'll see this box first. Box number 1.1. The first statement I've already discussed. The second statement, stress-free perioperative care helps to preserve homeostasis following elective surgery. So what does this mean? Any form of surgery performed on the patient is a type of stress or injury that we cause for the good of the patient, right? So we anticipate certain metabolic changes happening during the pre-op period, the intra-op period, post-op period as well. So that's what we learn in this chapter, like what changes do we anticipate when the patient is in trauma or when a patient is posted for surgery, so that we can take specific measures to avoid them, right? So at least those specific measures that we take, even if it doesn't help to maintain a perfect homeostasis, at least we can preserve the homeostasis as much as possible, right? Okay, and that stress-free perioperative care that we give the patient is what helps in preserving his or her homeostasis. Okay, and for that we need to resuscitate the patient. If the patient is nil per orally, then IV fluids are to be started. Proper surgical interventions, post-op critical care is also very important. That is what this table tells you. Now this graph from Bailey and Love is one important graph. The questions that get asked from this graph is that this graph basically means that the response to injury is graded. That is, smaller the injury, small is the response by the body, and larger the injury, greater is the response. What sort of response are we talking? It could be anything, physiological response or the immune response, the chemical changes happening, anything, any kind of response is always graded, right? Okay. Now the second question that gets asked is this statement. It is not a simple dose-dependent metabolic response, but rather it leads to a quantitatively different response. Had it been a simple dose-dependent, we would have got a linear graph, right? But this is not that simple. It differs quantitatively, right? Okay. The third question that gets asked here is the response to injury is also dependent on the genetics of the patient. These are the statements directly picked up from the paragraphs of Bailey and Love. So the response to injury is depends on the person's genetic variability also. That means certain people might be strong enough to tolerate even the major injury with just minimal response, but while certain people, even the minor trauma might bring about large metabolic responses in them. Okay. Going ahead, this figure, there are lots of questions asked from this figure. We need to understand what is this neuroendocrine response, the neuroendocrine response that happens in our body in response to any sort of injury or critical illness. Okay, let's break this diagram and try to understand it. So whenever there is injury, any sort of injury, be it trauma or the surgical incisions that we give, whatever it is, okay, whenever there is trauma, the first thing to happen is the pain sensations that gets carried by the efferent nociceptive pathway. Okay, the efferent nociceptive pathways are stimulated by pain. Right? So these nerve fibers, they first carry the sensation to the brain and then stimulate the hypothalamus and the pituitary to release certain endocrine hormones. Right? At the same time, it is the same efferent nociceptive pathway, or it is the same pain sensation that is also responsible for stimulating the innate immune system, which in turn stimulates the adaptive immune system. Okay, so basically whenever the patient suffers pain or whenever patient suffers any sort of injury, the efferent nociceptive pathways are stimulated. In turn, it stimulates two things. It stimulates the brain as well as the immune system, right? So now the first question that they ask is, what are the hormones that are increased and what are the hormones that are decreased in response to injury? Okay, maybe we can remember it this way. There are two hormones from the pituitary that are released, that is ACTH and growth hormone. The ACTH will release two hormones from the adrenal gland, that is adrenaline and cortisol. Okay, and one hormone from the pancreas, which is glucagon. Okay, these are the hormones that are increased. Okay, now let's see the hormones that are decreased, which is insulin-like growth factor, testosterone, and the thyroid hormone. Okay, we don't need insulin and its brother, insulin-like growth factor, because we don't want the glucose to be utilized by the cell when we need so much energy for to fight this stress or the injury that has been caused. So we don't want the glucose, we want more and more glucose in the bloodstream. That is why we have so many hormones increasing, all directing towards releasing glucose into the bloodstream. Okay, now The second question that they ask, this was one question, the hormones that increase. This was a second question, the hormones which decrease. Okay, the third question is, we said the immune system is also stimulated, right? So in response to immune system, what are the inflammatory cytokines which increase and which decrease? Okay, basically the pro-inflammatory, they ask the pro-inflammatory cytokines and the anti-inflammatory cytokines. The pro-inflammatory cytokines are interleukin 1, 2, 6, 8, TNF alpha and interferon gamma. The anti-inflammatory cytokines are interleukin 4, 5, 9, 10, 13 and the TGF beta. If you remember, TGF beta is the same inflammatory cytokine that is responsible for stimulating fibrosis. It will end all the inflammatory reaction and starts fibrosis in the body. Okay, this is purely a by heart topic, so maybe you can make a sticky note of these hormones, cytokines, and then keep revising it daily or at least alternate day. That is one of the ways to remember it. Otherwise it's purely a by heart topic. There's no way to remember it otherwise. Okay, these are the questions that might be asked from this figure diagram that has been given. Okay, one more question that they ask you is the change, what are the metabolic changes that happen in response to this neuroendocrine response, right? That is everything that is directed towards releasing glucose into the body. Lipolysis is happening, gluconeogenesis is happening, protein degradation is happening. This is again to give substrates for gluconeogenesis. Again, lipolysis gives substrates for gluconeogenesis. The acute phase protein synthesis is happening in the liver. Okay, pyrexia, there is fever because of the release of so many inflammatory cytokines, and definitely hypermetabolism is happening. Okay, this is also a question. This box basically says that the neuroendocrine response, whatever we saw here, right, it is basically biphasic. That is, it happens in acute phase as well as a chronic phase. Acute phase is one that happens within 24 to 48 hours of injury. Okay, and this is good for the body because it brings about all the changes which are beneficial for short-term survival. Okay, but the chronic phase, if this continues, if this neuroendocrine response is not stopped after a period and it keeps continuing, then it will lead to hypothalamic suppression, and whatever the hormones were released, it will suppress those hormones, resulting in chronic wasting. Okay, that is what it is. Okay, now coming to this box. So this box basically means that systemic, we said whenever there is injury, there are a lot of inflammatory cytokines that are released, and there is this inflammatory response that is happening. This is called as the systemic inflammatory response syndrome. Okay, now this is good for the body, but body also knows when to stop it. This inflammation has to be stopped after a limit. Okay, that happens by the body by release of antagonist, okay, and soluble antagonists and the soluble receptors. That is called as the compensatory anti-inflammatory response syndrome, CARS. Okay, this short form has been given in Bailey law, and if this again is good for the body. Otherwise, continuous inflammatory response would only result in destruction of the body, right? So systemic inflammatory response must be stopped by the compensatory anti-inflammatory response syndrome. Now, what if this is not stopped? If SIRS is not stopped and it goes on and on and on, or in excessive amount, then it will result in counter-inflammatory response syndrome. These three abbreviations may be asked. Just understand this concept. SIRS is good. CARS is again good because that is what helps to limit the inflammation. But if the inflammation is not limited, then it will end up in counter-inflammatory response syndrome. Okay, these are the questions, and these are the important uh, questions that need to be anticipated from these boxes. And again, this is one important question here. This counter regulatory hormones released are the cortisol, glucagon and adrenaline. This could be a potential question in the exam. Okay, let's move on to the next box, that is purpose of neuroendocrine changes. This again we have studied in the previous table only. If at all they give direct options, pick up the direct options from the table, then they would ask this, that is why does that neuroendocrine response happen, whatever the changes that we saw here, right? Why does this happen? This basically happens to provide essential substrate for survival. It releases glucose into the bloodstream for survival. It postpones anabolism, and it optimizes the host defense, because the both innate and adaptive immune systems are stimulated, right? And this is, again, just understand this concept, no need to mug up. What are the physiological responses to injury? Just remember, what if you fall down and break your leg, or if you fall down and break your hand, what is the first thing that you do? You immobilize, you take rest and you immobilize that hand, or you immobilize that limb, correct? Then there will be anorexia, you won't feel like eating anything, and then there will be catabolism, you lose weight, and you lose weight, that limb which is not utilized, will undergo wasting also. Just remember this. Next, the same thing, the same concept that we studied here, it has been given in a different way, which is called ebb and flow model. This was given by David Cuthbertson. Okay, this name is important because this is mentioned in Bailey and Lau. This can be a potential MCQ. Okay, David Cuthbertson. First understand what does this ebb and flow mean. The English meaning of this ebb and flow is, basically means like the waves in the ocean. There is rise and fall, rise and fall. That is how the response in the body also looks like, if drawn in the form of a graph. So there is one graph that is given in the Bailey and Lau, which is something like this. Okay, during the first 24 to 48 hours, it is ebb phase. Basically, this phase is a protective phase to conserve energy for the upcoming catabolism phase. The upcoming catabolism phase is represented by the flow phase, which happens after this 48 hours, basically third day to almost 7 days. Okay, after which there is anabolism. Here this also represents the same thing, initial 24 to 48 hours. This is a potential question. Okay, first, how long the ebb phase lasts, how long the flow phase lasts. 24 to 48 hours is the ebb phase, following which there is the flow phase, during which the catabolism, all the breakdown happens in the body, the lipolysis, proteolysis, everything happens, and followed by anabolism, that which means recovery phase is happening, which takes weeks after the initial injury. Okay, one important question that they ask here is the 5 important features of this ebb phase. This is again given in Bailey and Lau. 5 important changes or 5 important features happening in the ebb phase. So I already told you, it's the protective phase wherein the energy is conserved. So the basal metabolic rate, BMR, decreases. So if the basal metabolic rate is decreased, definitely there is going to be hypothermia. Okay, and then hypothermia will lead to lactic acidosis, correct? The deadly triad that we all learn. And then there is this and then again hypovolemia happens, and the cardiac output also decreases. Okay, these are the 5 changes that are given in our textbooks, and there are 3 important hormones as per ebb and flow phase. First one is the catecholamines, that is our adrenaline and everything. The second one is the cortisol, and the Third one is the aldosterone. This is because of the RAS activation. We said there is hypovolemia and decreased cardiac output, right? That will stimulate the renin-angiotensin aldosterone system, which will stimulate the release of aldosterone. This is as per ebb and flow model. Okay, this is slightly different as compared to the previous graph that we have seen. Just revise this consciously, actively, some 2-3 times, then it would be easy for you. As you keep solving questions in your mock exams, then that will help you retain better.